In today's episode of the Back in Shape podcast, we're going to be talking about what you should be doing if exercising is making your back pain worse, why that's happening, and some strategies towards the end of the podcast to really help you move forward in a more effective manner. And first and foremost, one of the biggest problems with back pain is that we have weakness. We can't protect the spine. And it's completely understandable that you might be nervous, you might be concerned, anxious about doing any sort of exercises at risk of making that back injury even worse than it already is. Maybe you've tried things in the past and they haven't worked. Well, we're going to explain a little bit today why some of that might be the case, but also hopefully give you that confidence to move forwards in a more robust, maybe cautious or conservative manner, but to ultimately start to rebuild a bit of the support for your lower back. Because unfortunately, doing nothing is doing something, and that something is allowing your body to get weaker and weaker and weaker and weaker as the weeks and months go on. So we have to put a full stop to that and really start to give you the confidence to move forwards. And I think one of the stories that we'll talk about towards the end of the episode will really shine a light on the clear consensus that there will be amongst all professionals about the way forwards, if that makes sense. Especially, it's particularly nice considering that there does seem to be maybe so much conflicting information on there or out there about back pain. So keep an eye out for that towards the end of the episode. Now, I thought it was a good place to start, knowing that over the thousands and thousands of members and patients we've seen over the years, more or less no one is bedbound when we see them. And they're able to move around, albeit with pain, albeit with aggravation, but they're able to move around. And we thought we'd take a look at some of the daily activities that you might be doing to explore those, and we'll come back to those activities towards the end. So first and foremost is the sit to stand, where you're probably even sat down in a chair watching this episode. Maybe you got out of bed this morning. That's getting up out of being sat down. You then moved around the house a little bit. You sat down in the dining room, maybe to have breakfast. Then you got up again. Then you've gone and sat in another chair. You sat on the toilet seat. You've got up, etc. But the sheer frequency of going into a chair and out of a chair is something that happens on a daily basis. And maybe you're even, in spite of the pain, still getting in the car to go places and come back. Oh, it's hurting my back. Oh, but I can't do any exercises. But you're still doing all of these things, and taking a moment with me now to review whether you're actually doing these activities every day is something that's so very vital, especially if you've got that belief that I can't do any exercises because that might make my back worse or I don't know what to do. Know that we're already doing some interesting things with that first example. The next one is doing the dishes, any sort of activity that involves you slightly leaning forwards. So we've got the example of doing the dishes. We've got the example of preparing food. Standing up at the work surface, preparing food, preparing a meal, cooking, chopping, etc. We've got washing our face in the morning, brushing our teeth. All those other sorts of things involve leaning slightly forwards with the head, the rib cage coming forward to the back, increasing the load through the lower lumbar spine. The lower lumbar spine being the area that most of us who have back injuries, most of you guys, will have a problem. That will be the source of your lower back pain. An injury down in that lower lumbar section, normally between L4 and S1, although there may be some areas a little bit higher than that are problematic also, including the sacroiliac joints as well, a little bit lower. But you're doing all of that forward bending that's taking place. It's not a massive amount, but as we lean forwards, it magnifies the weight of the torso on the lumbar spine and the supporting muscles, and that can be an issue. Assuming that we're doing it with perfect form, which most of the time we're not. And that's another issue that we'll talk about later. And then we've got the example of getting dressed, the simple act of getting dressed. Well, what does that involve? Especially the lower half, maybe not so much the upper half. But putting on your underwear, your pants, your trousers, shorts, whatever they may be, the socks, the shoes. We're doing those every day. You're not getting up and popping a dressing gown, or maybe you are, but you're still getting up to put that dressing gown on. And maybe you're avoiding actually getting dressed in the morning. But if you are getting dressed in the morning or changing during the day or in the evening when you go to bed, you're already doing rather complex movements every single day. And perhaps we're not thinking about that as a strain on the back. And we don't bring these up to make you paralyzed of even moving, but we bring them up to say that you're already aware that you're doing those. You're already doing those voluntarily, in spite of, in many cases, there being a significant degree of pain. And why is it that so many times people go, well, my back pain keeps just flaring up and I don't know why, there's no reason? Well, judging by having these sorts of conversations with members, etc., and patients over the years, when I then go through the examples that we've just been through there, you go, oh, well, yeah, I suppose I am actually doing those. I didn't think those were actual things that might stress my back, but actually they are. And why? Because movement is what causes a back injury. Movement is what causes the flare-ups of the injury. think about any example of any injury, not just in the back, but the shoulder, etc. It was a movement that was not controlled effectively that caused the injury, that caused the flare-up. It could have been a movement with a lot of load. It could have been a movement with a little bit of load. It could have been a complex end of range movement, but it was movement. If we were to just keep your body perfectly still and not have it move at all in any real degree, other than sort of the normal movement from breathing, there would be no injury. We would not have an injury unless, of course, we squashed the spine through a significant load. But then again, that involves compression. That involves a movement. We cannot injure if we don't move. And the more we move, especially in the early days, the more that can create issues. The more we move the injured part. That's not the more we move our body, because there are certain areas that need to compensate for that so that the spine can remain, or the injured site of our spine can remain as still as possible. But it is a movement that is what causes the flare-up. It's as you're turning around from the kitchen counter, and then the back went. It's maybe coming down the stairs or going down to pick up the little one or putting the shopping in the car or taking it out of the car. It's that movement that happened when the back went. It wasn't when you were still. It was when you went to move. Maybe it was after you were still for an extended period that you went to move that the back went. It is the movement. And that is such an important point that we have to have in our minds as we move forwards. And we're going to talk about some principles later on, two very important principles for the right exercises, and that will really be central to those points. So now, if we go into sort of two avenues, there's two real points from here that we can take. The first being a short one, and I'll go through that first of all, and then the second is going to be much more relevant to most of you watching this. And the first one is talking about the person whose injury was caused by exercise. You actually did some exercise and it caused the back pain for the first time. Now, the example, well, before we get into that, one interesting stat that I was reading in preparation for the article here on the New Scientist, I think it was that in the UK, and it was on data from about 2015 to 2017, so not too far back into the past, and it was adults aged 19 to 64. And in fact, only 5% of the population in the UK were actually doing any meaningful strength training. And that is training that improves the strength of your muscles, your bones, your joints, your ligaments, your tendons. That means everybody else was not doing sufficient amounts. So if you had been doing this, then maybe you were someone in the minority. But in this group of people who are actually starting to do some training, there are two categories. Number one is the person that's getting into activity. And these people will injure their back doing activities that really have no significant benefit, especially to the beginner. And these are people that start off in the new year. Hey, I want to get in shape, I want to get fit again. I'm going to start doing some of those classes or whatever the case may be. And you're doing burpees, you're doing sit-ups, you're doing squat jumps, movements there are absolutely no need for you to do to start with as a beginner. You can get perfectly reasonable, effective workouts without the need for such complex movements, which quite frankly, most of the time, if you look around a class, the newer people do not have the complexity and the skill and the requirements to do those effectively without starting to put all sorts of strains on areas of the body that are not used to it, especially when we consider the average adult spending 9.5 hours a day sitting at their desk. To go from that into some of these classes, it's just too much and unnecessary. So that's the first scenario, the people that injure their back during exercise. And it's always worth, we've had on two occasions relatively recently comments on the YouTube channel. One guy said, I started doing sit-ups, to try and get a six-pack. And after a week, all I had was back pain and I didn't have a six-pack. Exercise like these, which are just not helpful, or they're not guided. So you end up causing pain. Another person said something very, very similar with the example of sit-ups. I tried to do 50 sit-ups a day to get my core stronger. And all that happened is it made my back worse, or caused back pain, I think it was at the time. And these are such good examples of people getting into the wrong exercises with no foundation of strength work, no foundation of an ability to move effectively, no education on how to do that properly, and a severe lack of ability because of life, the way in which modern life, sitting and inactivity is so common, so prevalent. We just forget that actually, we grew up moving, but then we stopped for decades, perhaps. And we've kind of need to get back into that in a sensible manner rather than just going full hog and jumping into a class that many people have been doing for like maybe a year or 2 years. Many people in that class might have been doing that class for a number of years, and you're just popping in, doing the same sort of stuff and going, why did I get injured? there's good reason for that, and we're doing the wrong exercises. Now, the second person is the person that actually is just pushing themselves. They're an athlete, they're a powerlifter, they're whatever else, and they're doing some of this lifting, some of these workouts, and they've just pushed it a bit too far. They know it. But this sort of person, you're going to heal relatively quickly. You're not going to find that the injuries are persistent and long lasting. And perhaps that individual isn't going to have the same degree of fear for getting into exercise. So that's the first kind of avenue. Now, the second avenue is those that are, you've had back pain for a long period of time, you've got that sciatica there, it's going down the leg, you've tried a number of different things, you've tried different exercises, they haven't worked, you've maybe seen different specialists, and you're so worried that if you do any more exercise or any new exercise, it's just going to set the whole thing off. Now, hopefully by this point, you've already had a think about some of the exercises that you're already doing around the house, the squats that you're already doing, getting in and out of chairs, the other movements, the forward bending that we're doing, and the getting dressed every single day. And those things are the things that you really need to hone in on as sources of aggravation. Now, what are we going to do going forwards from here? What should we look for in the right sort of exercises? Well, there are two things. Number one, especially if you are nervous in this scenario, is spine stability. The main reason that you're injuring yourself every day is because, or on a regular basis for no apparent reason, is because you do not have the ability to stabilize your spine. Like we said earlier, it's movement that causes the injury or the flare-up. It is not the absence of movement. And there is a lack of control so often because when we injure a joint, any joint, its stability is therefore going to be compromised because you have injured the structures that provide the stability to the joint. For example, if we sprain our finger off to the side, we have damaged the ligaments here that maintain integrity to that joint. It's no different in the spine. Where you have an injury, you have loss of stability. So we have to try and use our muscles to provide that external stabilization in the short to medium term. And often it's the absence of use of those muscles, because it's not something we think about, that during all of those activities that we mentioned and many more earlier on that you're doing every day, you're not providing spine stability. So wouldn't it be sensible to start with exercises that promote spine stability first? Now, you'll immediately be thinking perhaps, well, why the hell did those guys recommend all those other exercises? The movements, the knee hugs, the knee rocking, the twisting, the sciatica flossing, all of that sort of stuff. What does it all have? Why does it not work? Because it's just a bunch of movement. You're moving things rather than providing spine stability. And if we suggest that even movement would be a good thing, movement does not have a cumulative benefit. Movement does nothing to rehabilitate you. Moving the spine through the knee rocking exercises or through the child's pose, you are not better off, you're not stronger in 6 months' time or 6 weeks' time. Whereas if you do strength-based resistance training, you are building cumulative strength. You're building cumulative control over your body and ability to provide more stability to the body, rather than just wiggling around like a worm on the floor for a number of repetitions repeatedly. It is not providing stability. So those sorts of exercises that so often you guys are recommended first, they're recommended on the NHS website over here in the UK. Many physiotherapists, osteopaths, even chiropractors will recommend them. Even, unfortunately, treatments like IDD decompression, patients will be recommended those sorts of exercises to go along a good treatment like that, or any other good treatment. They recommend the wrong sort of exercises that are undermining the actual treatment process. You're just wiggling the area that essentially is injured and needs stability without the provision of stability that needs to be provided in the rehabilitation approach. So that's very, very important. That violation of principle number one is just going to get you nowhere. So if you're choosing the right exercises that provide spinal stability, they're not only going to be safe, but also you might find that actually, do you know what? They may be a little bit difficult. Maybe I'm not able to support my spine. And that's where principle number two comes in. You have to choose the right exercises that are real to life. For example, if those exercises, those activities, that I mentioned earlier, the getting out of a chair, if you have got out of a chair, then a squat is a real to life exercise. Now, you can either continue to get out of a chair every day and get into a chair with bad form, not being aware of your spine, not providing spine stability, or you can devote a bit of time every day to starting to learn how to do that movement that you are doing every single day anyway, correctly. Granted, you're not going to get it right first time. You might find that it aggravates you a little bit. So we maybe do a simpler exercise to start with. It might be something as simple, for example, as a psoas engagement, where you lie on your back and you engage your core to provide spine stability. And then we bring one knee up to tabletop position, so to speak, and then you press against that knee, and that engages the psoas on the one side and creates a pulling sensation or a pulling force through one side of the body into the trunk. And that's where your core stability needs to be in place. If that causes you pain, that is because you have pressed into your knee into the hand during the exercise, and your spine has bent off to the side because you have not maintained core stability. If we can't do that without getting pain, if we can't control our spine in that position, lying down without getting pain, how on earth are we doing anything more complex like getting out of bed without creating the opportunity for problems to arise? And this is why breaking it down in this manner is so important, and starting to think about the right exercises in a different manner. So we start off weight bearing, and then we can build in more complex tasks like the squat, for example, that are on weight bearing. But know that you might struggle with both of those. But if you're already doing a squat, you better start that other exercise, the psoas engagement exercise that I mentioned, but you better start doing a squat, because you need to learn how to do that correctly. Because if you don't, you're continuing every single day to do movements that are problematic. You will benefit immediately from the thought process of thinking how to do the movement correctly and discovering how low you can go without your form being compromised and without your back moving and creating a flare-up or aggravation. But it's very, very safe. There's very low forces at play here. It's not like you're picking up shopping out of the car and moving them around. It's not like you're getting into the car and twisting your back whilst doing the squat. You're doing a very controlled squat, hopefully recording it or doing it in front of a mirror so you can see yourself, and starting to build skills that will help you not only do the exercises to build strength, which comes in time, but also that you can apply to those activities that I mentioned earlier, the daily tasks that you're doing, so that they can become ever safer as the weeks go on, compared to other exercises, which are the wrong exercises, which are doing absolutely nothing to cumulatively add to your health and well-being and overall competence when you're moving. Now, I'll just move over to a little anecdote, and then we'll kind of start to wrap it up there. And this is a really, hopefully this, if the penny hasn't dropped already, it should really drop now in terms of the broad-based agreement across everyone in terms of healthcare practitioners, be they osteopath, chiropractor, physio, your surgeon, your orthopedic specialist, your pain management person, your GP. They all fundamentally agree based on their actions, and you'll be able to conclude that by the end of this, I hope, is that even if your pain is really, really bad, you're struggling to walk, you've got a very, very bad spine. Say, for example, members that we've had in the program and patients over the years, we've got spondylolisthesis, which is basically severe damage to the point where the spine shifts off itself. We've got severe herniations of the spine, many other serious problems. Even in those scenarios, when you call to make the appointment with your surgeon or after the surgeon, they go, hey, yep, come in to the clinic and we'll see you, and we'll maybe send you for an MRI. What does all of that involve? Well, that involves getting in and out of a car, most likely. That involves going and sitting in the waiting room, then going and sitting in the office, then going and sitting on a treatment bench, getting down onto the treatment bench perhaps to be examined, and then getting back up again. Maybe if it's one of the other therapists, you had some treatment during that time. Then you sit back up again, you have a further conversation with whatever specialist it is, from the GP to the surgeon to the osteopath to the physio. You have a further conversation, and then you get back in the car, and then you go back home, and then you carry on doing whatever you were doing. Fundamentally, nothing has changed whatsoever in that time frame, in that scenario, which could be any number of your consultations that you've had over the years. Nothing has changed to make your injury better. Even if you were going in for an appointment with something like laser therapy, with something like PRP therapy, PRP injections, or stem cell injections, something that we could consider to be a healing therapy that's going to optimize healing and improve the healing in the tissues. It doesn't happen in a moment. It happens over maybe a couple of days to a couple of weeks after that time frame that the healing actually takes place, or starts to build, the healing effect starts to build. It doesn't happen immediately after you've had the injection. It takes time. And therefore, you're still, again, leaving all of those appointments, getting back in your car, and so on and so forth. There will never, or almost never, and over the tens of thousands of people, I've never had this happen, where you are in the surgeon's office, for example, and they go, right, I've got to call you an ambulance because your back is so bad you cannot even move. We have to get you into theatre. I've even had people going for emergency surgery where the surgeon has said to the person, they've said, or I've heard stories of this. This hasn't been this has been a patient later on after this appointment that I'm thinking of specifically, where the surgeon said, yeah, it's really bad. Just go and have surgery now. Get that discectomy done, and you'll be good, or we'll move on from there. And it was a case of you go to go and have the surgery. So he then walked, got in the car, went off and had the surgery in the next 24, 48 hours or so. But the point was that he was still instructed by a specialist who knows exactly what's happening in the lower back to get up, move around, basically do a squat a number of times and move around. So they know that these activities are, even when you're doing them without any proper instruction, are not going to be bad enough to cause any severe worsening of your lower back. All professionals across the board, from the GPs to surgeons, etc., as I've mentioned more times than I perhaps should now, It's getting a bit repetitive. They're all saying the same thing though. So this fear and this worry of the exercises, the right exercises, we need to just take a step back and say, what am I doing every day anyway? And what are these specialists willing for me to do in order to come in and see them and have a treatment? And squatting, for example, is one of those movements. Getting up and moving around is one of those movements. And so long as we start to do those movements with more thought and intent by way of controlled exercises, specific exercises that are real to life, the life movements that we've already been approved for. I'm not saying go and start doing handstands or anything like that. That's not something you're doing every day, but you are simply getting out of a chair. You are simply moving from one position to another in spite of the pain. So let's start doing some sensible exercises that focus on spine stability to protect the spine in the best possible way and teach us how to do that. And that are true to life, so they make those activities you're already doing safer and safer and safer. So you can then start to build confidence. Number one, that comes first, because you build a little bit of competence as a result. And then you can start building that strength and not feel like you are in a situation where you have absolutely no control over what can be done and you don't know what to do and you're dependent on someone else to fix the problem. Hopefully this little story and of that example and this episode itself and pointing out some things that you're probably already doing has made you think again about whether you can do exercises and know that even if they are painful, the right exercises done reflectively, maybe recording yourself from the side with your smartphone. We all have these smartphones now. We all have at least someone in the family who's got one and they can record us doing our exercises. If we're really in that much trouble, we should be moving hell and high water, or whatever the phrase is, moving the earth to try and get something done at home, because you can do that. You can really set things up so you can be very evaluative about those exercises. Because if you're not going to do that, do you really want to get better? Especially if you're already doing those sorts of movements around the house that we've already discussed. So hopefully this has given you a prompt to reevaluate the right sort of exercises. Now, granted, we talk a lot on the podcast about what the right sort of exercises are. We talk on other episodes about what the wrong sort of exercises are. And we've got the program as well, which can help you give you the exact step-by-step exercises to do, such as the ones that I've mentioned, and the support to go through that process as well. Some people, they just need a little bit of support as they're going through that, and that's what the membership is there for. So you can always check that out at any time. But hopefully this has given you a fresh look on exercises, especially if you are someone who was fearful of actually doing them for fear of it making your back injury worse. Hopefully it's giving you that confidence. I really do, because ultimately you have to make that first step. If we're that very vulnerable that the activities of daily living every day are causing us flare-ups, there's no treatment that can help that. Treatments can work to help heal the damage, but you have to do the work to rebuild the strength in those tissues. And if you don't, no one can do it for you. So you just need the confidence and the support to know that you're not going to make it worse if you do these things going forwards, and that they are just as safe as any other activities that you're already doing every single day. And unfortunately, the only way to learn how to do something is to actually do it. One final little analogy to close this off is, mainly because we've got a little one now who started standing up. They're going to fall over when they're learning to walk. But you wouldn't dream of saying, right, you've fallen over and you hurt your little knee or you hurt your little arm as you fell over. You wouldn't dream of saying, no, walking's not for you. No more practice. But equally, you wouldn't expect them to be able to do it straight away. And it's the same with your exercises. Some of you guys are really going to struggle because you don't have the skills to do it, but you need the support to do it in a safe environment where the risk of worsening is significantly lower, the risk of worsening the injury, although you might have some flare-ups, some bumps and knocks along the way, you will start to get better and better and better with each passing day at that movement, as long as you do it reflectively. So thanks so much for watching. If you do have any questions about today's episode, any concerns, any thoughts, please do leave those in the comments below. We read and reply to all of yours, and they help us shape the podcast as we go forwards through this next year of episodes. As always, if you do find the podcast helpful and informative, do consider sharing it with someone else who's struggling. Hopefully it'll give them that little penny drop moment to make them start to make the right sort of decisions and move forwards as well. Thanks so much for watching, and we'll see you in the next episode.